All right, so at this point, we have performed the fluoroscopic study. So the radiologist has made their dynamic diagnosis and requested that I perform overheads on our patient. All right, so we're gonna start with the esophagus, and then we'll do the upper GI. The esophagus consists of 3 different projections. On our protocol, that is a PA, an RAO, and a left lateral. So that's what we're gonna do on Bailey here, really quickly. To do this, we're gonna utilize a 14 by 17 lengthwise cassette. The specs in your book and in the lecture are all the same. We're going to put the top of the light field right about at the mouth, okay? And on the PA, we will be at the mid-sagittal plane, which I'll point out. And I'll point out some of the centering points as we go on the rest of them. So we'll do that, then we'll kind of break and we'll talk about the upper GI. So let's do that. So on a DR site, obviously, we won't have to worry about swapping cassettes. So let's imagine we're DR right. So Bailey, if I could, ma'am, I need you to lay on your belly now. I know the table's hard, it's pretty uncomfortable. All right, so she's on her stomach, which means her left side is facing me. And as you can tell, or if you can tell, she's very crooked on the table. All right, this one like, that's all right, I'll straighten you out. So what we're gonna do is just get her squared up and then we'll get it all prepped, okay? Okay. Ma'am, I'm just gonna move you around a little bit, okay?
Okay.
Just move your shoulders this way. Actually, you're not too bad. You're probably a little uncomfortable. So I don't like to use a pillow for this, but if I can, raise your head up slightly. I'm gonna give her the corner of the pillow, which Bailey loves the corner of the pillow. All right. That was a lot of facing. All right. So what we did is we filled this cup with barium, and it's usually a bigger cup. This is like an 8 ounce. It's usually like a 12 ounce cup. We filled it with the barium that we're going to use, thick barium for the esophagram. Place a straw in the cup, hopefully one with a bendy top, because this is going to be awkward. So I fill it up, and then I talk to my patient. Okay, ma'am, what we're going to do is I'm going to give you this cup. Be really careful not to spill it. You just kind of hold on to it with your left hand right there, all right? And then you're going to place the straw in your mouth, and I'm going to have you drink as I take pictures. Does that make sense? All right, so we're going to do that now. So set that there, and don't worry about the straw just yet. And then we just set up. I'm gonna move you around. So if you can see here, she's still a little crooked. I'm gonna just move your shoulders over. Are you okay?
Yeah.
All right, so now I'm gonna stab you in the eye with a straw and drop this shoulder just a bit. So a couple things to consider. Older patients that aren't as flexible as Bailey are going to want to put this right arm under their body. It's going to kind of cinch in because it's really uncomfortable. So you just need to make sure, be mindful that they don't put their hand in the light field. This hand, again, needs to be steady like that. Is this super comfortable, Bailey? No, it's bad, right?
Yeah.
So you want to be quick. You're still a little crooked. I'm going to push your hips, okay? Just, usually they're on a sheet, so they slide really easy. And I'm just trying to make sure her mid-sagittal plane is nice and straight. So if you look here at my light field, it diverges. So on the table, we just kind of want to put that past the lips. That's what I do. Uh-oh. I touched her straw. So then I collimate in about yay far, palpate the spine, and make sure I'm there, okay? Can you see the collimation? All right. So we do that, and then I'm like, okay, ma'am. And then I put that right in their mouth, okay? You don't have to do it.
Okay.
So it's in their mouth, and then I step out of the room, and I rotor. And then I say, drink, drink, drink. So what I'm trying to do by doing that is fill the esophagus from mouth to stomach, right? So if I get enough barium in, I can do that. So 3 slow drinks. Make sure you coach them to take large drinks when they do it. If you do that, and if it's DR, it pops up. If you have the entire column of the esophagus, the PA is finished. If not, then you need to have them drink again and do it. And explain to them that's kind of what's happening, okay? So, now we've done one. I'm gonna take this cup, okay? And what I'm gonna have you do is bend your left leg towards me. Yep, and roll your body back just a tad. Okay? And you can kind of have more pillow. Are you okay?
Yes.
All right. And then I'm
my other
gonna
hand.
put this in this hand.
Okay.
Just like that. So my goal is to get our oblique, I think 35 to 40 degrees or so. All right? And whenever I oblique someone, I try to put their shoulders and their hips in the same plane, no matter what procedure I'm doing. So that shifts everything back. Now, according to your text, again, we're gonna put the light, at the mouth, right? So it'll diverge to that point. I am not concerned with taking the mid-sagittal plane and then moving over a couple inches. What I want to do is, where's her esophagus? I can see her neck, so then I can see her esophagus. Anterior, we have the thyroid cartilage. Posterior to that is the esophagus. Behind that is going to be her spine. So I'm somewhere between her vertebra and her thyroid cartilage, which is about there. So I can imagine where I'm going to be, right? I might move posterior just a hair, and there we are. Now, for my marker placement on this particular procedure, by convention, we mark the side down. So she's in an RAO position. I'm gonna put it up top on the side down. Fix my collimation, and then repeat. Okay, ma'am, drink, drink, watch him swallow, drink, beep. Okay, you can relax. So that's our RAO. Finally, we're going to do an esophagus. Now, some places will do a right lateral esophagus, some will do a left lateral. I'm gonna do a left lateral for just because. So roll away from me if you would, face the opposite way. I'm gonna pull your pillow back though, because I don't want it in the way when she's holding this cup. Now, ma'am, I'm gonna place this over here for now. Don't worry about it right now. Put your arms together almost like you were praying, just like that. So if you notice, when people roll lateral, they rarely roll straight, right? Because I let her do it on her own, I didn't guide her. So I just make a few quick adjustments. So I need to push her hips forward and I'll pull her arms back. So I'm gonna do this real quick. If she's on a sheet, it's super easy. I put my hand at the small of the back, I'm just gonna push her hips, like that. And maybe I'll move her feet, because that will, the way I did that will increase lordosis. And then I'm gonna grab the bottom arm and I'm just gonna slide her back. I put a hand between the shoulder blades to make sure she's straight. She's lateral, okay? Now, if I exaggerated the lordotic curvature or the kyphotic curve, I might fix that for this, because it looks a little awkward when you go to do it. All right, so here we are. We're on her left side, which means I have to fix my marker. Right here. So we do that. We're gonna go ahead and collimate in, because we're not touching that again. And then I'm gonna do the same thing. Raise your chin slightly. And let me put this in front of you. And you just be careful not to spill it. Boom, I put the straw in her mouth. And I'm going to very quickly do this.
Sorry,
Hey, that's okay. We're recording. So we're gonna now place the light a little bit lower, okay? And that's okay. So our beam, notice her head is further away from the table. So our beam is going to diverge quite a bit more because of that, right? So I'm just gonna go right about there. And then again, just like on my oblique, I know where her esophagus is. It's gonna be between her vertebral bodies and her thyroid cartilage. So I'm gonna center about there. Your text will say that that's mid-coronal. So make sure the arm's out of the way. That is about mid-coronal on her. Maybe a little posterior to that. I'm gonna do that. And then I'm gonna run through my drinking instructions again. So there's your positioning. So that's the esophagus.